Well, February is Eating Disorder Awareness Month, and eating disorders have the highest mortality rate of any mental illness. And it's estimated that over 28 million Americans will have an eating disorder in their lifetime. Yet so many go undiagnosed or don't seek the proper treatment. And joining us today is Dr. Allison Chase, Senior Clinical Advisor for Eating Recovery Center and Pathlight Mood and Anxiety Center. Doctor, thank you so much for joining us here today.
Oh, thank you so much for having me. It's when disorders are that significant and the impairment is so serious, I thank you for bringing awareness to it.
Of course, and especially, this month it's being highlighted. So we wanted to talk about that. So how can you identify a eating disorder in a loved one or someone close to you? What do you look out for?
Well, you look out for a mix of both physical symptoms, right? We want to look for weight loss, and along with weight loss can come thinning of the hair, being cold all the time, being tired, having headaches. There are all those kind of physical symptoms of it, as well as the emotional too, right? Increased anxiety, discomfort. If you're seeing a change in their patterns, both in the way they interact and what their behaviors are, they're not engaging in sort of typical behaviors that you would see them do before, like joining parties or doing social activities.
And so how can someone struggling with an eating disorder reach out for that support once they feel comfortable to do so, or if someone is helping them get that support?
Right, and it can be really tough because those that are suffering from an eating disorder, it's serving a purpose to help support their emotional functioning that they're having a tough time with, and they don't always want to seek help, but it's so important that they get help. So if you have a loved one, the more that you can encourage, help, and be supportive of them and get them to professional help. So like where at Eating Recovery Center, there is a free assessment that happens, that you go online, you look for the phone number, to be able to just get some recommendations about what level of care might be appropriate, or just to start the process. And the more that you can support a loved one to start that process, please, I tell all, friends, family, you're not a professional in this, right? This is not something you have to take on yourself. The more that you can support them to move in that direction, to contact a professional, that's what's really important, to aim to get help started.
And before we let you go, what does that recovery process look like once they do seek help?
Once they seek help, it will be, first of all, an assessment about which level of treatment is most appropriate. What we always want to do, depending on the severity of the eating disorder, is get somebody in that level that's appropriate. So if we really need to take care of all the physical symptoms, like they've lost significant weight, or they're showing signs of an impact looking at their labs, or other physical symptoms and emotional ones, we want to make sure we get them to what we call higher levels of care, so we can get the most impactful treatment to start.
And I believe we have a website there that you can visit for more information. Dr. Chase, we ran out of time, but thank you so much for joining us.
Thank you for having me.
Of course. That'll do it for this hour. We'll be right back.